Hi, my name is Matt Schweitzer. I'm at the AAID annual conference in Atlanta. I'm here with Dr. Rami Salloum, who has given a main podium presentation, facial scan integration using the nose as a reference point. So talk to me a little bit about what your presentation was about.
My presentation was about integrating the facial scan to the intraoral scan, a step that can help us tremendously in aligning the intraoral scan to the face. And that will allow us to do facially driven prosthetic design. It's very beneficial into the digital smile design, the future of digital smile design. Because if we can see the face while we're doing our treatment plan, it will be very beneficial to our patient, very beneficial to us, and very beneficial to our lab technician. Because that step is giving us lots of reference. Imagine that we can have our patient in the computer at all times while we're doing treatment plan or while we're finalizing the fine-tuning of the prosthesis. So that was the first topic during my presentation.
And I want to ask a little bit more about that because it's the core of it is the benefit to the patient, correct?
That's correct.
So if an implant dentist is explaining this to a patient, how would they say it in layman's terms? How does this benefit the patient?
It's going to benefit the patient when most of my consultations with my patient, I have the patient sitting, seeing his facial scan integrated with the intraoral scan. So me explaining that treatment plan to the patient, it has so much benefit or a tremendous amount of benefit for him to be able to see what is my plan is. What am I trying to achieve? And I felt with so many patients, I did this to them, I felt they are more encouraged to feel, oh, this is the right office. And I'm agreeing with this treatment plan because they become part of the treatment, the decision making.
It sounds like they're understanding what's happening. It's like when you go into a procedure like this, like as a non-dentist, I would have trepidation, I would have fear, which is understandable, but this sort of takes away some of that uncertainty from the patient.
Yeah.
That's fascinating. So your second presentation was around rapid digital conversion, a simplified approach to doing a full arch restoration. Tell me about that.
It's, full arch implant restoration or full arch implant supported restoration is a very hot topic today because more patients are coming to our practices needing our help. They lost their teeth, especially on the lower. Nobody likes to deal with the denture on the lower. So this procedure is becoming more popular and there's so many different solutions now and everybody is trying to come up with a solution to make that process easy and predictable. My approach, I came up with a small device that you can attach it to two implants in the anterior region and then you can scan it in two places with something that I call hybrid intraoral extraoral scanning technique. And this is being published now with the Journal of Oral Implantology, the AID journal. And with this, we maintain to have a single model. We got rid of articulator, so there's no need for articulator. But we're using that small device that can be scanned in the patient mouth, connected to two implants in the anterior region, and then move to a single model. And to finish the scan or finish what we started, made it very fascinating. The lecture got really nice feedback, and I hope that would be beneficial to all of us.
It sounds fascinating, and we have over 1,000 people here, but unfortunately a lot of people couldn't be here. But your lecture will be available for them. What would you say some of the key takeaways would be if someone is going to be able to view your lecture?
They have to focus on the purpose of having a single model, the benefit from it, because that will help us to scan, that will help us to verify that our prototype is accurate and passive, and then also will help us to cement any metal tie bases within the prosthesis itself. The takeaway is I want anyone who's watching my presentation to focus on the hybrid intraoral extraoral scanning technique, because that idea will have so much advantages so in denture patient also. Because imagine that you can scan the bite in the patient mouth and then scan everything else outside the patient mouth. That's really the idea behind the hybrid intraoral extraoral scanning technique. And I really it's working really well for me. And I show it to one of my lab technicians, and he got so excited. And that's how it started. But then we feel that it's very predictable now, and I felt that I need to share it with the AID member because I'm part of the AID.
Yeah, and the key takeaways I hear is it's not just beneficial for the implant dentists and the technicians themselves, but then what's at the end of the road, the patient.
That's correct, 100%.
So it's the patient care.
100%. I mean, it's just like it's way easier on the patient themselves. The appointment is faster. It's very predictable. Everything is verified. The patient will gain lots of benefit by the end. And that's really why our profession is very exciting.
Thank you very much, Dr. Rami Salloum, for coming to the AAID studio. We are at the AAID annual conference in Atlanta. I'm Matt Schweitzer. Thanks for watching.